Okay. So we're going to change gear now and go into some more detailed content. And this session is really focused on the physical well-being in cancer survivorship. And I just wanted to briefly mention the questions that our group of speakers were actually asked to address. So the questions that we wanted this group to focus on were, are there cross-cutting physical well-being concerns in survivorship that are independent of the type of treatment exposure in specific cancer? Are there unique physical well-being concerns in survivorship that are relevant to only specific types of cancer treatments, such as younger age, childhood cancers, stem cell transplantation, brain tumors, pelvic malignancies? So we've got the generic as well as the very specific. What are the host factors, the characteristics of the person that they bring to the cancer diagnosis that may predispose to greater risk for some symptoms, such as fatigue, cognitive difficulties, sleep disturbance? And can we identify high-risk individuals? This kind of stratification, not just based on the treatment, but who the person is. And how should we prepare survivors for the potential for long-term physical sequelae of cancer and its treatment? A lot of what's been talked about in the first session, if we do know that something's likely to occur, how can we do that preparation? And how do lifestyle factors such as diet, tobacco, exercise, etc., lead to longer-term physical sequelae? And how can we do a better job doing that kind of preemptive intervention? So we really have a stellar panel, some people who've really worked hard to get here, but we'll start with our patient point of view, and Julie Silver, I don't see you. Okay, great. Julie's going to give two presentations in this session, and the first is as a patient survivor.
Great, thank you so much. It's great to be here. And when we had the session to prepare, what my invitation was really about to give the patient perspective, but also to talk a bit about cancer rehabilitation and prehabilitation. So we kind of split it up, and I'm going to start with talking about, really entering the kingdom of the sick. And one of the things that we say in rehabilitation medicine is that good health is a temporary condition. And unless you die suddenly and tragically, you're going to face significant disability and health problems in your lifetime. It's just, that's just what happens. And, thank goodness there are rehabilitation physicians and physical therapists and speech therapists and occupational therapists and a whole team to help because, people have lots and lots of problems. So there I was, feeling really good and healthy, and I ended up having to enter the kingdom of the sick. And I'll tell you a little bit about that, but first I want to tell you another story. So one of my patients, the same year that I was diagnosed with cancer, she got married. And then about a year later or so, she was almost declared dead. And she was in this car accident. And the wreck was so bad that the EMTs came and, they got the jaws of life and finally got her out, finally extracted her, and they thought that she had died. And then she started to breathe, and they said, oh my God, this woman survived this accident. And so what do you think happened next? All right. So this is how I felt after I had surgery and chemotherapy and I'd been through cancer treatment. I'd been through this really, really terrible accident. But we had two really different responses. For her, what happened is they said, oh my gosh, we're going to figure out all the problems she has, and we're going to send her to rehab, and we're going to make sure she gets all this treatment so that she can function as well as possible. Now, no one said to her after this accident, we're going to send you to the YMCA for an exercise class, or we're going to send you to yoga, which are really important and wonderful things. They are really important and wonderful things. But they don't take the place of rehabilitation for somebody that has a lot of impairments and problems. So there I was, after I was diagnosed with cancer and went through all this treatment, and I said to my oncologist after my last chemotherapy treatment, what do I do now? And he said, well, go home and try to heal, and someday, if you can, try to go back to work. And I was devastated. I mean, devastated. I had 3 little kids at home. I had, you know, a career at Harvard Medical School that I was not able to go back to. And I was really, really sick and exhausted physically, emotionally, everything. And so I had to figure this all out. So that was hard. But I'm going to take you back to what happened when I was diagnosed. Actually, a couple years before I was diagnosed, I thought maybe something was wrong. I had just had a baby, and I thought maybe something was wrong. And I went to the doctor, and I got some screening tests, and the doctor said, no, you're fine. You know, you see a lot of bad things. You're probably, you know, a bit of a hypochondriac, and, you know, so on. So went on. And I didn't really totally trust that doctor. I just didn't, you know, I felt dismissed. And so I did what I tell my patients to do. I went and I got a second opinion, because I just feel like, you know, if you're ever worried that maybe somebody's not listening to you, you should go get a second opinion. So there I went and I got a second opinion. And this doctor I really liked a lot. I felt really confident and so on, and, you know, had more tests and everything. And no, you know, you're fine. You really are. You know, the first doctor was really right. And I said, okay, that's fine. So then 2 years later, I said, you know what? I still am not quite feeling right. And maybe I need to go back again. I had 3 little kids at home, and I remember this thought going in my head and saying, I got to do it for my kids. Like, they need me to raise them. And so I went back for a 3rd time, and, you know, I went back to the doctor that I trusted and liked, and she came in and she said, she started crying and she said, you were right. And I was all alone, because this was my 3rd workup, and everybody thought I was a hypochondriac, and like, who really goes to the doctor with a hypochondriac anyway? And there I am all alone. And I mean, I don't mean anything, my husband's wonderful, but it was just, you know, it was just like another, you know, another workup, right? And there I was all alone. And I remember, oh, it was so devastating. I wanted to be a hypochondriac so bad. And people ask me all the time, they say, like, how did you know? Like, did you not get the right screening tests? Were they not good enough? Like, what happened? And all I can tell you, and I know, you know, people ask me this, and you're still going to be thinking about this, because I, you know, they cannot get away from this, but patients live in their bodies 24/7. We all do. And there's just things we know that maybe screening tests or workups just don't show. And that is why it's so important to listen to patients and really think about it. There are things. It's not like just because you had an MRI, or just because you had a blood test, or just because you had an ultrasound, that technology is perfect and will catch everything you need. So, you know, I just knew, and I don't know how I knew. But what I can tell you is it took me 5 years to tell this story. 5 years I could not tell this story. And why couldn't I tell it? Because my diagnosis was delayed, and I was not the earliest possible stage, and it was devastating. But then I started thinking about stages, and I remember doing this one interview, and this celebrity said to me, she said, you know, she was stage 0 and didn't have very much treatment. She had a wonderful prognosis, and she said to me, like, I'm so worried. And she was thinking about her stage and all this stuff. And I just thought, wow, you know, so many people ask me my stage, and I started never responding to that question, because I realized that every time you ask a cancer survivor, unless it's in a medical setting, it's sort of a negative question. Everybody wishes that they had an earlier stage or a better case scenario. So I stopped asking people, unless I needed to know for medical purposes, what their stage was. And I started just thinking about all these survivors that, regardless of their stage, are living and need help. So there I am, diagnosed. It's 2 years later, and I have to tell my mom. My mom is in California, and I'm in Boston. So I tell my brother and sister, listen, this is going to really be hard for Mom. You know, a cancer diagnosis affects a lot of different people, and I knew my mom was going to be devastated. So my brother and sister go with her, and I call at the appointed time. And I start telling my mom all this survivorship stuff. I start saying, you know, Mom, there's so many good treatments for cancer now, and you know, the doctors and the researchers are working so hard, and things have changed so much, and it's, you know, really important to know that, and all this stuff. And my mom is listening to me, and she goes, Julie, I don't really know what you're talking about, but your brother is sitting here and he's really upset, and I need to talk to him. No kidding. That is a true story. So imagine, there's my brother sitting there totally devastated too, right? Well, they didn't even live with me. Those are my family members that are 3,000 miles away. What about the ones that actually lived with me? So you want to talk about screening tests and who needs rehab? Almost everyone who undergoes cancer treatment needs rehab because, you know, the treatments are so difficult. So there's my little daughter doing a screening test for me, right? And she's saying, oh my gosh, my mom is not the same mom. My mom doesn't look like that. Now, if my little 3-year-old at that point can pick this up, we got to do a better job with our patients. I mean, really, we need to do a much better job. She knew this is not my mom. And it just wasn't like that my hair was gone. I couldn't function. I couldn't move. She's like, this isn't the same mom. Who replaced this mom? So fast forward, you know, well over a decade. Now, I've got a son who just started an MD PhD program this year. Got one of the NIH-funded coveted slots. Got his first scientific publication from the Ebert Lab at Brigham. And Broad Institute affiliated in JAMA last week, 2 weeks ago, is studying clonal hematopoiesis and probably will end up being an MD PhD cancer researcher. And I remember saying to this woman who was a cancer survivor, we were talking about our kids, and I said, my son always gets on his report card or whatever, he's so empathic, she goes, yeah. She said, my son too, but guess what? That's from the School of Hard Knocks. I'm really proud of my son. I think it's wonderful, but he suffered way more than he needed to, and he's written about that. My daughter, my middle one, she actually came to Washington, D.C. with me, and we rode all around the mall and had so much fun. We got caught in the rain, we got drenched. That one, she just came from Chile, where she was working in an orphanage. And she goes to the University of Notre Dame. She wrote about her experience with my cancer for every single college application. And she said, it was way harder than it needed to be. I didn't need to suffer so much. The system let my mom down. So this woman comes up to me, and I was given a talk, and she came up to me and she said, Dr. Silver, she said, every patient should be given cancer rehab. And she said, I was so excited about being done with chemotherapy that I made myself a graduation outfit. And I graduated, and I said I was done. But I still don't feel very good, and not one person has offered me cancer rehab. So I'm going to talk in a couple more minutes, a few more minutes about cancer rehab, but my experience and the reason I'm here and why I'm so passionate about this is because I'm a rehab doc, and at the end of the day, I do know how to rehab myself, even though it was really, really, really hard, and I wasn't in any position to do it at the time. I still did it. Most people are not rehab doctors, and they can't really figure it out all for themselves. And so, as we look at the survivorship care puzzle, and this is not meant to represent every piece, but there's a really central piece that helps people to physically and emotionally and cognitively recover, and that's cancer rehab, and I'm really happy to be here today. Thank you.